Across all anxiety disorders, anxiety is obviously the major symptom and feature of it. There are a number of different sorts of anxiety disorders, and for many of them, when the anxiety is really severe, a panic attack can occur. And this is where you get overwhelmed with a sense of fear. You might believe you're dying, you might believe you're suffocating or dying of an asthma attack. Going with that, you get a whole range of physical symptoms, such as your heart pounding and racing, feel like you can't catch your breath. You might get numbness and tingling around your lips and your tongue and your fingertips and your toes. You feel as though the world isn't real or you're not real in some way. And you just have a great need to escape the situation. Well, that's a panic attack. These can arise in any one of the anxiety disorders that we see. Anxiety disorders are very, very treatable. They're very treatable with psychological approaches, and people respond very well when they know what it is that's affecting them, and they have some education about how it is producing the symptoms that it is, and an approach to get better from it. Generalised anxiety disorder is a disorder where the person is overwhelmed by worries. They're worrying about things that could go wrong. They're worrying about the everyday events that most other people aren't concerned about. It causes them a plague of physical symptoms associated with their worries, heart palpitations, sweaty palms, diarrhea, feeling like you go to the toilet all the time, maybe headaches, those sorts of things. And the fears are really disproportionate to the reality of the situation. So it's a whole range of different fears and anxieties. Usually it starts off early in life and is with the person over a lot of their life. And other people around them will often call them a worrier. There are a number of treatment interventions that are effective for this disorder and can be tried, including various different sorts of psychological therapies as well as relaxation therapies. Sometimes medication may be necessary or helpful. Panic disorder is a disorder of recurrent panic attacks which affect the person's functioning. And what a panic attack is an extreme experience of fear, but there's no sort of thing there to make you afraid. So it's not as if you're about to be eaten by a lion and you're afraid. It's the same sort of feeling as if you're about to be eaten by a lion, but there's nothing there to cause it. It just happens out of the blue. So you're struck by a sudden sense of fear, and your heart's pounding, you can't catch your breath, you might need to go to the toilet, you feel tingling in your fingertips and your toes, numbness perhaps around your lips, you might feel the world isn't real, and you feel a great need to just escape the situation. That's a panic attack. Now, when it happens recurrently, it can really impact on your life, and you wish to avoid all sorts of situations you might think are going to lead to you having a panic attack. When people start to avoid going into the public situations like going to the shops or leaving your house, catching a bus, because you're afraid you might have a panic attack and you won't be able to get any relief or rescue, then that's called agoraphobia. You might get the same thought coming back in your head all the time that you can't get rid of. Seems like a pointless or silly thought, but it just keeps coming back nevertheless. For example, you might think that you've got germs on your hands and you're going to contaminate stuff. You wash your hands and you think that should be enough, and then the thought comes back, you've still got germs on your hands, so you keep on washing your hands. And that, if it interferes with your life, is called obsessive compulsive disorder. And there are a number of different obsessions that people can have. It could be around safety, like are the switches turned off safely? There could be a fire in the house, something could flood, I've got to check that the doors are locked, all those sorts of things. And it's if that thought keeps coming up recurrently and it's intruding and you know it's silly and senseless and it's causing you problems in your life, well, that's obsessive compulsive disorder. And once again, obsessive compulsive disorder is a disorder which is quite treatable. Post-traumatic stress disorder is a disorder where the person's suffered a severe trauma at some stage in their life. And the severe trauma has got to be enough so it's a threat to your life or your health and your safety, or a threat to somebody that you're really, really close to as well. And it affects you in a number of ways. It causes you impairment. And what actually happens is you re-experience that trauma either through a nightmare or through intrusive memories or through flashbacks, as though you're almost there and reliving it. In a way, it distresses and disturbs you. You try to avoid things that lead you to, that reminds you of that trauma, and you develop a number of anxiety symptoms that go with it. If you're on edge, you might be having acute panic attacks, and you have a heightened response to any shock and loud noise and so forth, and you often have this sort of sense of the world's changed in some way, and I'm not happy in myself. People can really constrict their lives as a result of this disorder. And the treatment of the disorder is usually, if you get in early, it can be psychological treatment. If it's been there for a long time and is quite severe, you might need a combination of psychological treatments and medication. Social phobia or social anxiety disorder. This is an anxiety disorder where you fear that other people are going to make a negative appraisal of you. So you think they're going to think badly of you. You think that you're going to make a fool of yourself in front of them in some way. So much so that it causes prominent anxiety symptoms, and you avoid the situations where you might be under scrutiny from somebody else. So it might mean that you avoid, for example, meeting a group of people, talking in front of a group of people, going to meetings, going to shops, lining up in queues, getting on public transport, or really doing any sort of meaningful social interaction, making phone calls, that kind of thing if it's really severe. So it can have a profound effect on people. It's not just shyness, it's an anxiety disorder, and once again it needs treatment and responds quite well to psychological treatments particularly. Specific phobias are where you have an overwhelming fear of something that causes you impairment or distress. And, for example, spider phobia. Most people can identify with a fear of spiders. And not many people actually really enjoy spiders, but it's a phobia when it affects your life and affects your functioning and it preoccupies your thinking. And there are many different sorts of phobias. Fears of heights, for example, fears of storms, fears of enclosed spaces, fears of vomit. There are many different sorts of phobias, and these disorders are pretty easy to treat with psychological approaches.